members have joined. Where can I see? So, wanted to test this live mode to discuss cases and some things which are what you can call daily learnings sort of thing, which we see in our day-to-day practice. So let me check whether somebody has joined or not. Let me figure it out. Okay. So two members I think have joined. I'm not sure how to do this. Where can I let me check? Okay, so 12 members have joined. I'm not sure where the chat is coming. Uh, did anybody has written something? Okay, so we wanted to test this guideline live mode so that we can discuss the cases on day-to-day basis or certain learnings on day-to-day basis. Hope my voice is coming. Okay, somebody said hi. Yeah, Chichura 9. Very nice. Parth, Munjal, yes. So I'm using my AirPod, so I was not sure whether it will pick up my voice or not. I hope the voice is clear. Okay. Thank you. Yogesh, also hello. So I'm not very much very familiar with this. Good evening, Yogesh. So I'm not very familiar with this live mode, but I'm trying it so that certain aspects which we came across on our daily rounds or learnings, so we can spontaneously discuss those things. So as of now, the point I'm traveling, so I wanted to discuss a particular point regarding our upcoming book in recent and landmark trials in critical care. Okay, cricket by chance. Okay, quick question. I'm your ventilation coach. Do I get access to YouTube here? I have get paid member via YouTube. No. That is a different issue. YouTube is different, and the ESBICM web panel is different. So. Just wanted to ask you all uh, that we are coming with our second edition of recent and landmark trials in critical care. So the first book went very well. There we covered many trials in it. Now, what I want is those who will see this or those who are seeing this, whether we want to expand the literature, I mean, we expand the chapter so that each trial is explained in a more detailed way, or you people want a snapshot sort of one pager for a particular trial. The idea, the purpose of both is different. Mm, the first thing is the snapshot gives you a quick info regarding that trial. What was this trial about? Where to exclude? Why? Where not to use like that? So you get to get a immediate snapshot of that. While the detailed description, or it will be a 9-10 pages literature of a particular trial, clinical trial. So it will explain you what is the statistics, why it was meant, why it was used, what is the meaning of that. So that when you get to read by different trials, by the end of, if even if you read 20 trials, you will be well accustomed to read clinical trials. So just wanted to ask that whether we should go for a detailed one, more detailed one, or a snapshot of sort of handbook you people need. So let me know in the comments. I'm not sure you people have very crazy names. Like this one is 21 F6R. Thank you for okay. So you like the icy shots. Thank you for that. Many thanks. So anything you people feel other than clinical trials, what we are missing here on the ICU channel or by ESBICM, anything from your point of view that what we should use this live feature, going live feature, whether we should discuss the day-to-day cases like that, because ICU short and long lectures give you theory part mostly, but the things which we are seeing clinically daily we can discuss in a span of 5-10 minutes coming live and discussing those things. It doesn't require that much edit, so I can do that. Other things requires a lot of edit. Okay. So cricket by chance, detailed ones are good. Yeah. So typically, if it download a document of a single trial, it is usually 10, 11 pages or 10 to 15 pages. And our explanation of that clinical trial also 10 to 15 pages, but we try to describe the trial in a way that it covers all the understanding regarding the reasoning regarding the trial. Now, okay, so cricket by chance start from very basic to advanced like go low, how slow policy, so we can understand. Okay, low go policy. Yeah. Parth, I'd say in the Erasure less is more, although I haven't had a chance to review your initial book, but snapshots will be as a yeah. Parth, I would request you to go to the ESBICM panel, member panel, and in the e-library you can download the free ebook. It is the recent and landmark trials and critical care. Now in that, what in the second edition, we are covering up the remaining trial which came in the last 18 months. And then we are trying to provide a snapshot and also a detailed version, more detailed than the first one. We'll enhance the first version also. But the only point which is our concern of our ESBICM team members, they are saying that detailed ones, um, we should cut short the detailed ones. But I am of the opinion that in the initial stages, whenever somebody reads the trial, to get a better understanding of the trial, maybe you don't read all the trials in that detail, but some trials are there. You need to understand those trials, and make a habit of reading it. I'm not sure how that much help, but snapshot and detailed description, I think it is required. Also, we need to put snapshot at the start of the chapter or at the end of the chapter. The my suggestion is to put it at the end of the chapter, so you make a habit of reading the trial and then go to the snapshot. Okay. Any advice? I'm going to start internship. How to utilize most of things? I'm outside this. Please answer. So, in internship, do attend the clinical postings. I'm very much sure that nowadays what happens that everybody is into getting that post graduations and MCQs and preparing for them. But you see, when you get a post graduation, you get a specified branch. Many of you may put up a clinical one, and many of you may take a non-clinical one. But the exposure, the basic exposure of every posting should be there. You will never get a chance to do all those things. So make a schedule, you prepare for a post graduation, but at least make sure 3 4 hours you are going to the posting to see the patients, to like ortho postings, gynec postings, medicine postings, surgical posting of certain common conditions you will get to find in your clinical practice in internship only. So do utilize that time. People are missing that, and later in their careers they feel that it's a bit difficult. So that's my advice to you, that you keep preparing for your clinicals exams, post graduation exam, but do attend at least 3 4 postings, 3 4 hours in postings. You will once that phase is passed, now you will miss that why you have not attended like that. So that's my advice, because I also missed that some internship postings I really missed. Okay, so now I got it. There is a problem in this. Anything anybody else wants to do, say something, because I think I am comfortable getting used to this comfortable. Now recently, now the next IC shot which I'm preparing is how to thrombolize, when on when not to thrombolize a pulmonary embolism, based on the latest 2026 guidelines, because like that. So, can you discuss issue cases more often? Yeah, Parth, I think live sessions, I think I need to use for that one only, because in ICU short, in the long lectures, we need to prepare certain things, lectures, read about a comment and go through it. But live sessions can be used for something which we have seen in the ground today itself, or a day or two before that, so that we can discuss with you what was the learning in that particular point of time. Can we insert images also in it? I'm not sure how to, and if anybody, if you have idea how to uh, add images, I think I'm not. Somebody asked Dola Chintu, are you an actor? No, I'm not an actor. That's you. Most of you see me in the top frame only. If you see in my full, I have a huge tummy, which I don't feel like showing. Just saying thank you for the content you're providing. In the word of everything is paid and still getting those shots which are quick revision. Thank you, What's your name, 216R? uh, what's actor, but doctor. No, no, I'm definitely not an actor. I came randomly as it is. I came. So I'm traveling basically right now, so I got a time to test this feature. One of my colleague is about to come in the Hyderabad. She will join me next 20 minutes. So I got some time. So I, I, uh, I wanted to test this live vertical feature. Basically, those who are attending, seeing this live, the purpose in Hyderabad is I've been invited by the Google headquarters. So we'll be visiting there. Sashank is asking, are there Venti and ICU course on the website or free? It is sure that was, yeah. Yeah, we ran the pilot batch for 9 months. It was free. It was 300, more than 300 candidates. But actually, because of the sustainability issue, a lot of things going to for as of now. So the next batch is a paid one. But now the session for the July batch is closed. No more, no more. We are taking any enrollment. Oh, cricket by Dr. Saeed. I recognized you. So you are Europe. You saw live. So just came over to listen to. Okay, Dr. Saeed. Thank you for joining from there. So I think I will be using this live feature to share the thoughts about what went through in the day or in 24-48 hours. This is something I think we can use it. Any other suggestions you people feel that this live feature we should use? What do you expect when I come live? Whether we should discuss cases or we should discuss random things about the intensive care, the non-academic but related, like how to deal with the burnouts, or how to deal with the consultants, how to deal with your colleagues, what challenges you face. That thing we need to discuss here, or we need to discuss the cases only. Okay, so Parth. Okay. Okay, thank you, Said. Thank you, Dr. Said, for attending. Yeah, Parth, cases. Now, cases, only thing we can discuss cases is what we saw and what is our plan for that, something like that. Because I'm not able to see any feature or to share the images and all other things here. Okay. Okay. So, yes, sir. Please put it this. Okay, so we'll try to discuss some cases and then we'll figure it out how it is going. So we'll figure it out that how we should discuss cases here. Like yesterday was a patient, young patient with pulmonary embolism. There was a dilemma whether to thrombolize and not to thrombolize. So, like thing. Sir, in live you can share interesting one definitely sometimes beyond also like the scope of our clinical branch. Yeah, Manish, that's really interesting. That what is the scope of branches and ICU cases like thing? Mm, yeah, we can discuss that. Means some non-academically related to questions related to critical care. I think we need to um, discuss. We can discuss. We can use this feature live. The good part is we can communicate directly. You people are posting the comments, and I can understand what is going on. So this gives an idea to connect in a real time manner. So I think we will use it. So thank you for all of you joining this. So I will take a leave now, and we'll try once again whenever I have something to share. We'll definitely use this live feature. I'm not sure whether you people use this live feature or this. I can use this horizontal one also. but horizontal one will use it for the detailed ones, I think. And I think 10-15 minute session is more than enough. More than that will be a difficult challenge. I hope this 10-15 minutes cases discussion is fine. Yeah. Yes, Parth. So we want to discuss that latest guideline. So there is one thing in that in category D, you need to have a patient with pulmonary embolism with normotensive hypotension, normotensive hypoperfusion. So how do you pick that? That's the key. I hope I will record that ICU short. So just a question for you. So how do you pick up normotensive hypoperfusion? Because that becomes a category D. Other than that, it is category C where you don't thrombolize. So if a patient is having normotensive hypoperfusion, then we need to thrombolize. So that was the catch. So this is something, I think horizontal one is something which in which I can share you images also. This vertical don't have a feature. Uh, no, VQ, no. There are specific things in it by which you can do that. Let me check if I can images. Choose a sticker, poll, countdown. No. Uh, I don't think there is a feature to add images. I need to show that table. Anyway, okay, so that's all for now. So we'll try to figure it out how to. Just a second. I think here is something. This is playables, and this is shopping. This is settings. Okay. So here I'm not getting a thing. So I will learn how to share images in the live. But but this is I am doing from mobile, na? So that's a challenge. But I'll do the live from my that laptop. So from laptop we can share the screen. That will be good idea. So that way it will help. Okay, so thank you all for joining. See you soon. Let me take a important call. It is coming right back and back, so maybe it's interruption in between. And thank you all for joining. And we'll be using this live feature more and more. Thank you. Let me check how to end it. See the I'm so new to it that I'm not able to close it. Just a second. Just a second. Just a second. Okay, I got it. Thank you.